Everybody, welcome back to DRTV. I'm your host, Jay Friesen, with
Brian Mattson.
And you all know from Dead Reckoning Radio, our regular host on Dead Reckoning Radio, Hadley Heath, joins us today. Hi, Hadley.
Hi, thanks for having me.
But the best part is, Hadley, you're not joining us necessarily as Dead Reckoning's favorite radio host. You're joining us as the Senior Policy Analyst for the Independent Women's Forum, where you do senior policy analyzing.
That's right. I also have another title. I'm Director of Healthcare Policy with the group, but I like to sort of play tricks on people. When I'm talking about healthcare, I use the title Director of Healthcare Policy. When I'm talking about anything else, because sometimes I like to share my opinions about other things, then I go with Senior Policy Analyst to be more broad and sound like a generalist. So
perfect.
It's a trick.
Tell us, first of all, a little bit about IWF. Where does it align itself ideologically on the political spectrum? And then we'll talk about healthcare.
Well, it's a wonderful group. We are all women. I've been working there about 5 years, and the mission of IWF is to increase the number of women who value free markets and personal liberty. So we are constantly trying to get the message out about free enterprise and the way it benefits both men and women, but specifically our message is for women. And we talk about a variety of issues from healthcare, which is my area, to energy and education. We say all issues are women's issues. That's our motto. And it's been a great place to work these 5 years.
I like that motto.
That's a good motto.
Yeah, sort of a rejection of the pandering that happens always around this time of year. You know, we need to talk about women's issues as though you're not interested in all issues.
Right, and we sort of resent the shrinking down of so-called women's issues to just those that deal with reproductive health. It's not that those issues aren't important. It's just that idea, that premise sort of fails to recognize women as full human beings who participate in the economy and have families that they want to care for, and who pay attention to issues like health care. Most women who go to the polls and vote in each election aren't going thinking about reproductive health issues, but they're going with a broader sense of ideology or direction for the country in mind.
Okay, so you said free markets, personal liberty. So clearly this is a conservative organization. I mean, does IWF see itself as really kind of on the other side of, say, National Organization for Women, the Now crowd and that sort of thing? Is that where you see yourselves?
Yes, we are. I like to say we're the black sheep among women's groups, because the vast majority of women's organizations in D.C., especially the ones that are really well-funded, tend to be pretty left-wing. And they have innocuous-sounding names, you're right, like the National Organization for Women. But if you look at the policy stances of most of those groups, they are left-leaning. They've sort of hijacked, unfortunately, the term feminist or feminism, and they've made it so that if you want to call yourself a feminist, then you sort of have to support a set of very liberal policy programs. So IWF is the alternative to that in a lot of ways. I think it's fair to call us conservative. Some people call us libertarian as well. But generally we emphasize free enterprise and the ability of women to contribute to our economy and the opportunities that are afforded them through a free market system.
That was like an amazing infomercial for IWF right there. Right?
Well, not and a segue. So
Yes.
Speaking of free market opportunities and options for women, healthcare. What are some of the, obviously, Affordable Care Act? I ditched the
Unaffordable Care Act, as we like to
boy.
call it.
It's headache-inducing.
Yes.
Headache-inducing. What are some other alternatives out there for us that don't want to go down the path of the Affordable Care Act?
Well, that's a good question. It's a hard question because, unfortunately, you look at the political spectrum, and the Affordable Care Act or Obamacare has become like a lot of issues. It's a stalemate because you have on the left Democrats who pass the law in a very single partisan sort of way. And on the other hand, you have Republicans who for years have made it their goal to repeal Obamacare or the Affordable Care Act. So it's a very divisive, very polarized issue. And another thing I think that IWF does well is takes a step back, tries to reframe the issue. And we've done that recently with a new video series called Straight Talk About Healthcare, and it features a woman named Beth. It's an animated web video series, and it's kind of cute. I mean, it's simplification. If you're going to fit something in a 2-minute animated video, you have to oversimplify in some ways. But our message is, we could return to a world before Obamacare. Legislators could easily pass a law that repeals every word of the ACA if we had the right people in office. But doing that would create a lot of complications as well, because the system we had before Obamacare also was not a free market. There were a lot of regulations, most of them at that point in time coming from the state level. Very similar regulations to the ones that we have at the federal level. It depends on which state you lived in. But some states would require a lot of these coverage mandates. They'd require you to carry maternity coverage, even if that's something you weren't interested in. And those mandates raise the cost of healthcare. Another big part of it is that our system's very centered around employers. So most people who have private health insurance in the United States get their health insurance from their boss through their office. That's not to say they didn't earn it. It's just part of their compensation. And the reason that is because that's tax-free compensation. You don't pay income taxes on health benefits at work. And most people, especially people who are in that system, think this is great, this is wonderful. I get health benefits on the job. But from a 30,000-foot view, there's some problems with centering our healthcare system around employers. Some of those are moral problems, and I'm sure you guys have followed, issues like the Hobby Lobby case
Sure.
or the Little
Yep.
Sisters of the Poor now. But there's also economic reasons why we shouldn't center our health insurance around employer-centric groups. But as long as the tax code is the way it is, we're going to see that some people will be underinsured, some people will be overinsured, but people won't be buying the most, the best fit policy for themselves and their families. So we want to move the ball forward. We want to move the conversation forward and talk about how can we really put individual consumers in charge, not your boss, not a big health insurance company, not a big hospital, not big government, but you, the little guy, the patient, the consumer. And in the third of these, the final video in the series, Straight Talk About Healthcare, we talk about, how we can get there.
So Beth is IWF's answer to that famous Obama cartoon, Julia. Remember Julia? They in the last campaign, they had Julia, who they track her through her entire life about how the government took care of Julia from cradle to grave. So you guys have...
And they portrayed it as a good thing? I don't remember
so
that at all.
You don't remember Julia? Oh, Julia, yes. Julia gets everything from the government, and it's amazing. There was no husband, there was no family, there was no community. It was all... Julia got all of these
Did she have a
great
baby?
things. Yeah, well, yeah. She
Did
had
the
a baby.
government impregnate her?
Well, kind of. I guess that was sort of the implication. but
Yeah.
But so you have Beth, and so this is your anti-Julia. Explain to us, just give us, you said there's 3 videos, if you could, and this just really intrigues me. Can you give me the kind of the bottom line on each one of these episodes? What is Beth experiencing, and what are you suggesting using Beth as the example?
Well, in the first video, Beth's just deciding to start her own business, which is something that a lot of women who participate in IWF or are fans of IWF, that would appeal to them because they're enterprising women. And so she wants to start her own small business, and she finds out that when she leaves her employer, she is faced with a different set of options when it comes to health insurance. If she wants to buy her own health insurance, for example, she's going to have to use her post-tax dollars to do that, so there's a tax disadvantage to doing it that way. And she's got to follow, whatever mandates she lives under in her state. So the message of the first video is really, we didn't have a free market in healthcare before Obamacare, and we wanted to make sure that was very clear, because a talking point we hear from the left all the time is, well, we tried a free market in healthcare. We really tried, and that was a failure. Clearly, that's what brought us Obamacare. And we don't see it that way. We don't think that we've ever really had a true, undistorted, free market that centers around patients and is driven by market forces. That would be the most efficient way to allocate resources in the health sector. That's a very economic way of saying it. But outside of, the economics class, the English version is that's the way to help the most people get their hands on the best health care for them and their families. And the second video, Beth is living under Obamacare. So the second video is really the experience of Obamacare and how Obamacare is just doubling down on all the bad ideas that we saw before Obamacare. It takes us further in the direction of employer-centric healthcare because it mandates that all employers of 50 or more workers provide health insurance, and it mandates what everybody's plan has to have. Making sure everybody has to buy comprehensive health insurance coverage. And part of the message here is, having health insurance doesn't necessarily mean you have access to the best health care. People are different. That I shouldn't even have to say that. People are different. People have different preferences. People have different budgets. They want to buy a different kind of health policy. And when the government sort of gets in bed with the insurance companies, what we get is everybody's required to buy not just insurance, like we buy car insurance or home insurance that functions as a backstop against unexpected sort of catastrophic costs, but insurance has become like a third party to every transaction that we do in the healthcare system, whether it's buying, pretty routine pharmaceutical drugs or whether it's going to see the doctor for a checkup.
Right.
We don't have any direct interaction with our doctors anymore because the health insurance company always has to be a part of that. They control which doctors we can see or not see in our network. And so that's a source of frustration for Beth. And then in the last video, we talk about, how can we reimagine this system so that it really serves Beth?
Let's talk about two things strike me. I want to talk about the way forward, how we can reimagine this. You made a comment earlier about how having insurance so employer-centric, you said from the 30,000-foot view, there are economic reasons why that's a bad thing. I think that might strike people as an interesting idea. What are the economic problems? What are the problems with having our healthcare mediated through the employer?
Well, for one thing, from the consumer side, if you are someone who happens to have an employer offer of health insurance, then you're kind of one of the lucky ones. Your employer is maybe paying all or part of your health insurance premium as part of your compensation at work. You might be asked to contribute, but all of this is happening through a tax exclusion. So you're not paying taxes, and that's great for you. But there's a lot of people in this country who don't fit that mold of going to work for an employer who offers health insurance. So if you are unemployed, for example, or if you want to change jobs, then you might be caught in this sort of weird individual market that hasn't been very functional. And one of the reasons it's not as functional or robust or competitive is because most people are in the employer pool, the large group pool, or the pool where employers do the shopping. And from the other side of the equation, this is a problem because if you look around your office, let's say you work in a big corporation, you look around your office at your office mates, you might find some people who are a lot older, you might find some people who are a lot sicker, you might find some people who are very risk averse and who think, gosh, I don't want to have any deductibles for anything because I think some bad things are going to happen to me and I don't want to have any of my own money on the line.
The hypochondriac in the office.
Right.
Right. So, people have, I don't know how many times I need to say it, but this is a very individualized market. And when people are different, they ought to have different choices. But if you have to agree around the office, there's actually an episode of the old TV show, The Office, where they're trying to decide on a group health plan. And so everybody's saying, well, I need coverage for this. Well, I need coverage for that. And so by the time you add up all the needs of all the people in an office, you're going to get a pretty robust health insurance plan. And I'm going to be a part of buying coverage for myself and my family that we don't need, that we'll never need, that we don't even want.
Right.
And so buying in groups that way means that people aren't getting the best fit for themselves. And so that's the second reason why I say that. The first reason is because actually Democrats talk a lot about this, and good for them. They talk about this issue of job lock. If you get into a job that has great health insurance benefits and you think that moving jobs or starting out on your own to do maybe a more non-traditional kind of career, then you might feel trapped into that job because of the health insurance benefits. And then on the other hand, it causes a lot of people to overinsure.
Yeah, that is so true. I was having a conversation with a friend just not 3 or 4 weeks ago who has he works for a big corporation and he's got a job and gets great health benefits. At the same time, in his spare time, he started his own business. In kind of a hobby of his, and it's very successful. And I keep asking him, so when are you just gonna bail on the big corp job and go off on your own? And he says, I can't. The health benefits I can't replace those health benefits. So job lock is a real problem.
Well, you can't. I mean, I've got one of my companies. I'm the only employer. It's where I get I'm the only employee. I'm it. But because of the new Obamacare mandates, I've had to throw it all out and find private health insurance, and it's been a gigantic, expensive pain in the butt.
So the way.
Well, there's two.
Go ahead.
Well, I just want to mention a couple other reasons. You look at today's economy, and unfortunately, we've got sort of 3 decades low when it comes to labor force participation. There's a lot of people who aren't in the labor force at all, right. And some people who are what we call involuntary part-time. If you're working in a part-time job, it's not likely that you're going to have an offer of health insurance. So there are a lot of people in our economy who aren't served well by this sort of traditional full-time job with benefits model anymore. And then on the other hand, when you look at wages in our economy, one of the reasons they're stagnant is because healthcare costs continue to grow and grow and grow, and it would be much better for employers if they could take the cost of health insurance out of the equation when they're hiring new workers, and they could focus on, for example, giving raises.
Right.
That's sort of unheard of in today's economy, but they could give that cash to their employees instead of having those raises eaten up by the increase in healthcare costs.
Great. So what's the way forward?
Yeah, I was going to say, way forward.
What does Beth find out in the third IWF video? What is the way forward?
Well, this is important because I think another talking point from the left that too often goes unanswered is that there are no conservative ideas. There's no such thing as a free market healthcare system, or my favorite, their healthcare plan is just don't get sick.
Yeah.
But that's not true. That's actually a terrible falsehood, because for decades Republicans have been proposing and conservatives have been proposing health reforms that would recenter the healthcare system around the individual. Now, a lot of this would take a difficult transition. I think it was unwise of the president to say, if you like your healthcare plan, you can keep it, because first of all,
wasn't true.
He should have known that his healthcare reform would make it so that was not true for many people. But then on the other hand, there's a lot of variables you can't control if you're the president. Sometimes people lose their health insurance plans for different reasons. But if we were to reform the healthcare system to be more market-driven and more patient-centered, one of the first things that we would do is try to equalize the tax treatment of the employer-sponsored health insurance plans and the health insurance plans that people buy on their own. And some of the people who have proposed to do this are running for president currently, but some of the plans say, let's put a cap on that tax exclusion. Instead of having sort of an unlimited, tax-free, buy as much health insurance as you want if you're an employer for your employees, then there's a limit. You can only, give maybe a certain individual up to certain thousands of dollars per year in health insurance benefits before they have to start paying income tax on it. And some people say, well, let's just get rid of that tax exclusion altogether. Let's just make health insurance benefits so you have to pay taxes on them. And that is the bad news bears of this situation, right? Nobody likes that side because it sounds like a tax increase. But the most important thing is that would be offset by a tax deduction that's universal, or a tax credit that's universal, so that every single person in the country, if they're working, if they're not working, has some help, some encouragement, some incentive to become insured. And, you might say, if you're truly a free market purist, you would say, well, even that is bad, Okay. But it would be, after decades and decades of having the government sort of subtly encouraging or nudging people to buy health insurance, it would be a real shock to the system to take all of those incentives out of the system. But a much more,
I think it's a little more shocking on that point. I think it was a little more shocking when the government suddenly declared it as a matter of law that everybody must purchase health insurance. That was a shock.
Right. That wasn't a nudge anymore.
Yeah, right.
That was a mandate. Right. So, of course, conservatives don't support mandating anybody to buy health insurance. But if there is going to be an incentive, it ought to be equal for every person instead of benefiting only people who get their health insurance a certain way.
Okay. Wow.
Oh, that's...
How about, okay, so I'm an individual. I have been incentivized to go buy a health insurance plan. I go, to esurance.com or wherever I go, and I plug in all my details, and voila, all of the insurance policies come, and they are unaffordable. What are we going to do about this, Hadley? We have unaffordable health care.
Right. Well, it's a real problem, but the reason it's a real problem is not because markets don't work. The reason it's a real problem is because we don't have markets. We don't have any competition. There's no reason why insurance companies would compete for your business or my business. They're making all the big money off big contracts with big corporations who offer health insurance plans to their employees. So under a more free market healthcare system, what you would see is two major changes to the private insurance market. First of all, we get rid of the mandates at the federal level that say you have to buy this piece of coverage, that piece of coverage, just a laundry list of items that you have to be covered for, when in fact most people, especially people who don't have a lot of assets to protect and don't have a lot of income, they ought not be forced to buy comprehensive health insurance coverage. They ought to just be covered for, if they have a terrible accident, right? Or if they get a terrible diagnosis.
A catastrophe,
a
catastrophic health insurance.
that would make premiums so much more affordable. And, people could save their own money in a tax-free account like a health savings account, and that would help them too. Another big change you would see in a more free market system is the opposite of Obamacare. See, Obamacare takes risk out of the insurance equation. And so if you're a young person, or if you're a healthy person, you're a person who doesn't really use the health insurance system very much, you suffer the most under Obamacare, because the idea is that everybody pays the same thing. They're trying to Obamacare is trying to turn health insurance into one big pool of money we all pay into as we're required, and we all take out as it's needed.
Social Security for health.
I was actually just going to ask you
Right.
that. How is that different than the Ponzi scheme of Social Security?
Right. Well, it's actually different in one important way, and that is that even though the government is running the show here and controlling, telling health insurance companies, this is how much you have to charge, you can't base this on risk, you can't base this on that, they leave the private health insurance companies in existence. And they're sort of private in name only. They're not actually making any meaningful business decisions. It's the government behind it all. But just the fact that those private health insurance companies are still in existence allows them to keep their talking points about how capitalism is bad.
Right.
Any remaining problems in the system, they say, this is the fault of private health insurance companies. And that's why you have people like Bernie Sanders who propose to go even further down the rabbit hole and have a completely socialized, completely government-run healthcare system, like a single-payer system. So unfortunately, the thing about Obamacare is it's deceiving. It's not really got any private element left to it besides the names of the companies on the logos next to the plans that you pick on healthcare.gov. And they're all the same plan. They just have different icons next to them.
Let me ask you just one more thing. I keep hearing about the getting rid of the interstate buying health insurance across state lines. What do you think about that? Would that help inject more free market principles into our health system?
Well, the principle that I can't emphasize enough is competition, right? We don't have any competition today because everything is over-standardized. And allowing people to have flexibility and choice and meaningful choice, meaningful competition would put downward pressure on price. It's the only way to put downward pressure on price. The only thing Obamacare does is price controls. The real way to control costs is competition. And the reason people like the idea of removing those sort of artificial borders or barriers between states and allowing people to buy health insurance across state lines, because it would open up the market to a lot more competition. Now, policy-wise, it's not as simple as that, because you run into questions of state sovereignty, and can states decide what they think is, eligible as health insurance. Typically, health insurance before Obamacare was something that was regulated at the state level. So there's state health insurance commissions that have some authority to say, they could say, we're in North Carolina. We've decided to recognize any health insurance policy sold in South Carolina.
So you'd have like a reciprocity system similar to what they have with like
that.
Concealed carry permits, right? We
Yeah.
recognize these states,
Right, but it's difficult to, it's hard to say whether or not the federal government has the authority to say, states, you have to accept any health insurance policy from any other state, because that might not be really honoring the federalist system.
Wow.
That was just so wonky. It was delicious.
Yeah, wow. Yes,
I hope
but
it wasn't
it's also
too wonky.
It's also a very complex issue. So out of the whole takeaway out of this whole thing is we need to continue pushing for healthcare reform.
Yes.
Essentially.
Right, and Ronald Reagan was warning against socialized medicine in the early 60s. He was actually warning against Medicare and Medicaid, but he said it's very easy to disguise, socialized or state-centric health reform as a humanitarian project. And I think that's exactly the goal of Obamacare supporters. They want Obamacare to seem like a humanitarian project, and they want to pull on people's heartstrings and say, look at all the people who have health insurance. Would you take that away from them? But that's, people need to put on their sound mind, their thinking caps, their reasonable ears, and listen to both sides of the story. And I think that they'll find that the better way to serve our friends and neighbors is to have a free market system. You look at any product or service in the United States that's been free. Those are the areas of the economy where we see the most innovation, the most prosperity, the easiest access, the best prices, the best value. Why wouldn't we do the same with the most important thing, which is healthcare?
Beautifully said. Okay.
Beautifully said. Final question. Okay, we only have a couple minutes left, but before we go, the Conservative Party actually has a pretty favorable female presidential candidate. So as the Independent Women's Forum, are you gals swooning over there? Are you just like in love, or are you like, we like her.
What's
but
the general feel, Hadley? Everybody excited?
I would say, it's a great time to be a conservative woman, thanks to Carly Fiorina, because we've had several women run for the highest office in the land in the past, and we've had lots of prominent conservative women over the years, but Carly Fiorina she's got it all. She's the whole package. She's a great communicator. When she closed her statement Lady Justice, it was beautiful. It was beautifully delivered. She's incredibly smart. She's got incredible presence of mind. I think she represents the best of what conservative women have to offer this country. And so I think she's a great representative for me and for people like me.
I think that sounds like the answer is yes,
Hey,
Jay. Conservative
all right.
women everywhere
We're
are
swooning.
enamored and swooning with Carly Fiorina, and
I kind of have a crush on Carly myself. Just put that out there.
Got Carly fever.
Carly Fever. Hadley, where can people keep in touch with? Where can folks keep in touch with you and IWF?
They should visit the Independent Women's Forum website, which is iwf.org, and they'll be prompted as soon as they come to the page to watch these videos that I've been discussing today, the Straight Talk About Healthcare series. They can also find IWF on Facebook, or on Twitter, or on Pinterest, or on Instagram, or on just about any social media platform that is out there. IWF is there.
Fantastic. And to find out more about Dead Reckoning, www.deadreckoning.tv. Terrible. Dead Reckoning Radio, where Hadley takes off the IWF cap and puts on the I'm Hadley Heath in Denver cap. And she sits around with us and we talk for about an hour and a half on the radio show. You can subscribe to our podcast feed so you can receive that also on our website, or just click the play button there. With that, thank you for joining us. Hadley, it's always a pleasure. Brian,
Thank you guys.
it's a pleasure to be with you too.
You too, Jay. Back at you.
Yeah, I'm Jay Friesen,
I'm Brian Matson.
and this is DRTV.